At this European Hematology Association meeting, which was conducted virtually, there was a poster presentation that was focused on the role of Venetoclax in combination with Azacitidine in patients with higher risk treatment-naïve Myelodysplastic syndrome. This is a phase 1b study which is ongoing. In this trial, patients who had MDS were treated with Venetoclax on a 14-day schedule from days 1 to 14 in combination with Azacitidine. The Venetoclax was delivered at a dose of 400 milligrams per day without a dose ramp up and with no requirement for tumor lysis prophylaxis because of the generally lower rate of bone marrow blasts in these patients. Total of 78 patients were treated, and these patients had very high-risk disease, with 2/3 of patients actually having myelodysplastic syndrome with excess blasts -2, that is, with a bone marrow blast count of between 11 and almost 20%. In terms of the safety, the major adverse event associated with Venetoclax plus Azacitidine was marrow suppression and marrow toxicity, with a grade 3 rate of neutropenia of 60% and 44% of patients with febrile neutropenia. The median cycles of Azacitidine delivered to patients was 4, and the majority of patients had Venetoclax dose interruptions, mainly because of hematologic and non-hematologic adverse events. In terms of efficacy, intention to treat response rate was extremely high with Venetoclax plus Azacitidine for patients with higher risk MDS, with an overall response rate of 80%, which included 40% of patients with CR and 40% of patients with marrow CR. Furthermore, the median time to response was very rapid, with the median time to CR of 2.6 months and a median time to marrow CR of 0.9 months. 23% of the study population were able to move on to post-study allogeneic stem cell transplant. Furthermore, the overall survival of the study population was also very encouraging, with a median overall survival of 28 months for the study population. For patients that had achieved a complete remission, the median duration of the median survival of patients achieving complete remission was almost 29 months in this study. There was also some subgroup analyses performed and presented on the poster, which included different molecular subgroups of patients on the study. And this demonstrated broadly that patients had a very high response rate to Venetoclax plus Azacitidine across the board, including patients with P53 mutation. 26% of the patients on the study had a P53 mutation, and the overall response rate was 83%, with a true CR rate of 16%. Therefore, this study demonstrated that Venetoclax plus Azacitidine is a very active regimen in higher risk MDS, and it has a very rapid potential to eliminate blasts in the first few cycles, and therefore is an excellent treatment, particularly for patients who are heading for allogeneic stem cell transplant, where blast clearance is considered particularly advantageous. Thank you.